what makes my testimony a little bit different here today is that I am, to my understanding, the only person who's been on one of these agents. And so I'm Sharol Klise. I'm a 51-year-old mortgage professional from the Seattle, Washington area, and I've been a migraine sufferer for over 35 years. To address your question earlier about age, I am officially postmenopausal and have as frequent symptoms and attacks as I did prior to that. In that time, in this last 35 years, I've been both episodic and chronic. I've experienced symptoms that have ranged from moderate pain, auditory disturbance, insensitivity, vision impairment, including temporary blindness, nausea, projectile vomiting, debilitating pain, the list goes on. I have, in that time, also tried a myriad of medication options, including narcotics, because that's what was available when I first started having migraines, anticonvulsants, triptans. None of them have worked. Zero effect or increased debilitation for me. So for me, these attacks have caused things that maybe you all take for granted. Going to work every day, driving a car, going for a walk, making plans to go to dinner with your friends or family. You lose job advancements, you lose relationships, including my marriage over this. These are not insignificant things, and the real world cost is much different than the models that you're looking at, okay? So since being part of the research study, my life is completely different. I can go to work every day. I mean, that sounds crazy, but I can actually make a living. I can, not stress about paying my bills. I can be an employee who an employer wants to support, and is worthy of promotion. Sounds silly, but as an anecdotal thing, I was able to go to 2 concerts last year that required that I purchase tickets more than 6 months in advance. 2.5 years ago, I would have not been able to commit to being here today because I didn't know if I could get on an airplane and come across the country. So I understand from reading the report that there are some things that, make these agents seem as if they're not cost effective. Well, let me talk about some of that quality of life and income loss for those of us for whom the other medications don't work. These models don't even come close. For me personally, we're talking about hundreds of thousands of dollars from lost work and lost opportunity. And relationships to which you can't put a dollar value. Insurance costs, I hear a lot about insurance costs and this and that. So for me, insurance costs and outpatient out-of-pocket costs are a concern, obviously, but right now I'm employed and I have health insurance. But I will tell you that since being on this agent, I've had no ambulatory visits. I have had no check-ins to the emergency room. I have had fewer primary care doctor visits because I'm not trying to treat symptoms. And that is the significant, I actually was able to this year lower the insurance plan that I am on because I know that I don't have to go to the doctor as many times per year. So that's a cost savings to me, it's a cost savings to my employer, it's a cost savings to the insurance company as well. So, I want us to look at things like what is our overall societal cost? What happens if I don't work, if I don't have health insurance, and I'm relegated to being on some type of public assistance? That's not good for anyone. And it's not good for our state of mind as a patient either. So in conclusion, I thank you for your mindful consideration of the cost of quality of life, productivity, insurance, and most importantly, please consider those of us that the other drugs don't work. I'm not suggesting that if triptans work, we stop prescribing triptans. I'm just asking that you consider the rest.